Welcome to this special Gastro Girl podcast. This episode was produced in collaboration with the American College of Gastroenterology's Patient Care Committee. Here's your host, Jacqueline Gollin.
Hey everyone, welcome to the Gastro Girl podcast. We have a really awesome episode today. We are with Dr. Drew Triplett, who's a gastroenterologist in Dayton, Ohio, who's also a marathon runner. He's run over 20 marathons, so that is so cool. And we're going to talk today about exercise-induced GI distress. And do we wonder, is it IBS or is it something else that's our exercise habits are causing us? So welcome, Dr. Triplett. Nice to have you on today.
Thank you for having me, Jackie. Very delighted to talk with your audience about GI and running, two things that are very dear to me.
Yeah, so I've been a runner my whole life as well. And I must admit, I've often wondered if it's IBS or is it something that the running is causing, or am I nervous before a race? Is that happening? So let's just get right into this. Can exercise cause GI distress? Does running cause the things that we may be feeling?
Yes, absolutely. So we know from many studies that 30 to 90% of all exercisers experience some GI distress, whether that is mild things like upset stomach, heartburn, reflux, maybe diarrhea, or even more severe conditions that perhaps would hospitalize someone in the case of, say, like an Ironman triathlon. We know that this is a very common phenomenon and very commonly encountered condition amongst runners is my little small segment, but this can be any exercise. Predominantly, we're thinking about endurance athletes or people who are going, say, more than 90 to 120 minutes.
So, this is an interesting topic because, as endurance athletes, oftentimes we are drinking a lot of Gatorade or other drinks with a lot of electrolytes, or we're taking those power bars and God knows what's in them. So is it the actual exercise, or is all this special stuff that we're taking to make us run longer? How do you know?
Sure. So we think that predominantly the exercise, the physiologic changes within the body, as a general thought, we are using the blood flow for our muscles to provide power for exercise, which is taking blood flow away from our gut. And so that relative low blood flow state or relative ischemia, you could think about, that is delivering the blood flow to the muscles for exercise is actually taking blood flow away from the gut. So we think there's a large blood flow or ischemic state, but also things like temperature. We know our body is regulating our temperature when we run. We know there's mechanical forces, the actual sloshing of our stomach. And so that Gatorade or water that's in your stomach is being forcefully moved by the exercise or the running. We think there's a lot of factors that come into it. You raise the concept of energy drinks and goos or gels or whatever you want to call that whole sector of sports nutrition. Maltodextrin is frequently used, and we know patients have, or runners have, issues with digesting these carbohydrates. And so people do sometimes experience more GI distress, which generally comes with the sensation of bloating or indigestion because of those drinks or those gels, whatever you want to kind of call that whole sector, whether you put it in a mixer bottle and drink it as a liquid, whether you put it in a goo form, or whether you make your homemade paste. There's many, many different things that people have tried. Even when you talk about super endurance athletes, perhaps drinking soda as one of the earliest forms of sports nutrition. There's all these cool stories of people taking the cap off the Coca-Cola and then drinking flat Coke for energy. Well, of course, we know why they're taking the lid off. They're decreasing the carbonation so they have less bloating and distension, which leads to belching and can lead to vomiting. So hopefully that gives an overview, a little bit of this interplay.
Yeah, what I'm really fascinated about, you talked about ischemia and low blood flow to the stomach. Can you kind of break that down into layman's terms as to why that would cause some of these GI symptoms? Like, what is that actually doing?
there's less blood flow for digestion in the stomach and the intestines. So we have
It's just sitting there.
we have a blood flow system called splanchnic circulation, which is the technical name for the little blood vessels that feed into our gut. And the blood flow state is reduced during exercise because the major muscle groups are taking more blood flow to power exercise. And so this low flow state, if you think about the faucet, just won't turn up as fast. And so when you need the stomach or the small intestine to process nutrition, then it just can't do it. And that usually can cause symptoms for the runner. You could think about football or basketball, any team sport, soccer, anything that is going to increase the heart rate for a prolonged period of time that is going to require blood flow recruitment to the major muscles. We think this is the major trigger. Anything that's going to require temperature regulation where you're sweating is probably going to be included in this area. So this has traditionally been labeled exercise induced, but I would say that running is probably the prototypical event. Triathlon is another one that gets a lot of attention. So full distance triathlon is going to be in the realm of 8 to 20-ish hours, depending on the athlete's performance level. And so you really are going to tax the body with that long. When we think about road marathon, it's usually 2 to 7 hours, depending on the cutoff for the race, how long people are taking to complete it. And so that's probably the prototypical event with the most participation is the road marathon. But we know people are doing all sorts of interesting things that are taxing their bodies and would fall under this definition of prolonged exercise.
So how common is this exercise-induced GI distress? How common?
So like 30 to 90% is broad range, depending on what your sport or what your population is. So almost everyone, up to 100% in some marathon running population surveys have experienced some distress. It depends on how you define this. Almost everyone has had some form of runner's trots, diarrhea, knowing that they need to go to the bathroom either during or after. We also know that any sort of heartburn or belching, indigestion, if you include those topics, then you get closer to 100%. When you focus in on things like rectal bleeding, that's when you're getting a lower percentage. So there's a reasonable number, depending on the exact study you look at, somewhere between, say 1 and 15% of marathoners are experiencing rectal bleeding, thought to be due to injuring the colon from low blood flow state.
So is that why, is it the pounding as well? The pounding and the pressure that you're putting in the lower body? Could that, the constant, when you're running, you're just constantly pounding the pavement. Does that have an effect?
Yes, so mechanical force or jostling definitely would have a role in GI distress as a whole. When you think about specifically rectal bleeding, it's probably all a low blood flow, ischemic state in the colon. Of course, we know runners and exercisers are prone to having hemorrhoids, which can cause bleeding, which we contribute largely to the stress and the pounding and the tensing of the body can lead to hemorrhoid formation.
Wow. So I have a couple of questions here. So the first is, what can athletes do to reduce or lessen these symptoms? What are some things that they could do?
Practice your nutrition and your habits. So trying to figure out a race plan that works for you, because most people go harder in the race than they ever go in training. And so this is when it flares up. And so I would say a few keys to think about. One is getting up well before your race time. So 2 to 4 hours before your race, getting up, getting your body acclimated to being awake, and then trying to use the restroom. So have a bowel movement, get your bladder empty, get to the start line in plenty of time. We know that the stress of getting to a start line often triggers people to go to the bathroom. And so trying to have a good plan about where you're going to use the restroom, where you're going to go, what your fluids are going to be, what your nutrition is going to be, when you're going to take your nutrition. All of these things, having a good plan can really divert a lot of this. When we think about a plan for a race, it goes back to the days before. And so there's many different opinions on what to do as far as increase carbohydrates. Most people would say you want to decrease your fats, decrease your fibers slightly in the hours or couple days before an endurance race, and you want to increase your carbohydrates to have a ready supply for carbohydrate for the race. But I think really most of the prevention comes in having a good routine before. We talk about specific topics like coffee. So coffee is a big thing. Many people want to have their coffee to feel energy. Well, that's a bit of a double-edged sword, right? Because if you drink coffee, then you put fluid in your stomach, which is going to jostle and could make you upset. You're also most people are drinking caffeinated coffee, which we know can cause a relaxation of the lower esophageal sphincter and incline people to reflux. And then they go jostling and they squish all that fluid in their stomach up into their esophagus and their chest, and they feel heartburn and they're distressed by it. And so it's a bit of a double-edged sword. So trying to drink that coffee or the caffeinated drinks before you start running, I think is one way to decrease that. And then practice. A lot of this comes by practice. Like, what can you tolerate? How much coffee? When can you take it? And then, people will do all sorts of things like decreasing their creamer or their dairy in their coffee to just make it a little easier to digest on the system as they go.
Yeah. And now I just want to point out and ask this. This distress doesn't just come on race day. Like, we could just be out for a practice run and we could feel possibly some of this distress. Absolutely. So I just want to note that. So it's not just tied to the race, although if you're like me, it's more anxiety inducing when it's race day.
Absolutely. Yeah. I think race day is where all the pressure is. People get stressed and anxious. They're often in a new place because training runs, most people are from home or from a common gym or meeting point. They know where the restroom is. They know where the water fountains are. They have their bottle or their backpack, whatever they need. And then the race says, oh, you can't bring your bottle or your backpack, and you have to use the porta potties in the secure area. And then people start getting nervous and their routine gets off, and then things go wrong and they wonder why. And that's why you were stressed and you changed your routine.
So let's go back to your suggestions for the porta potty routine and making sure you have a bowel movement, because that's stressful. You're like, oh my God, I haven't gone to the bathroom yet and my race is going to start in a half an hour. What do I do?
Yeah. So having a plan of where you're going to go, I think, is key. And then having a routine with your fluids. So I like to drink the same fluid mixture before each race. And I try to do that I generally try to do that 1 hour before the race. And I consume traditionally my 16 ounces of water, and I use a product called UCAN that people might be interested in if they suffer with GI distress. It doesn't have immediate release sugars in it. And it has a fascinating backstory because it is considered a super starch or delayed release formulation. It tends to be a little bit easier on the gut. And so I have the UCAN powder in water about 1 hour before, and then immediately I will go to the restroom, try to empty the bladder as well as the bowels. A couple of things that I find helpful. Many people use a squatty potty or trying to get their knees up in the air to change the angle of the pelvis. You can do that in a porta potty by putting your clothes bag underneath your feet. And then you can bring your knees, generally right leg and left leg, up to the chest in a rhythmic contraction. And that can help stimulate colon activity. So we know we have the gastrocolic reflex, or where if something goes in the stomach, the colon can move. So drinking the fluids or eating your nutrition and then moving the body. We tend to stand in lines. At least that's the American way.
Yeah.
We stand in line. And so sometimes bringing those legs towards the chest can help stimulate the movement.
Yeah. So in terms of food, like, there's no one size fits all. What may work for you may not work for me, and vice versa. In terms of eating, again, just go back to your practice, like what works for you on a normal run, and what you can adjust for race day. So do you have any tips for that? Or are there any foods that we should avoid for sure that are going to cause issues across the board? Or what do you think about that?
I think most people would say you want to avoid fats, dairy, and fiber. Those are probably the big groups. Most people are eating carbohydrates or things that are easy to digest. We hear people eating rice cakes, bagels, applesauce. Sometimes you hear people eating plant white rice. A lot of these things will be going around at the racing expos, and that you hear that's what people are eating. Sometimes people want to put a little bit of protein to try to get some energy, maybe with some peanut butter or almond butter or something. But in general, you don't want to drink like a big glass of milk and eat a Totino's pizza like we're in college before the race. It's not very hard to hard to imagine that that's going to make some distress. Myself, I tend to be a fasting runner, and this is beyond the scope of the conversation about debating the merits of running during a fast or not. But I find it's easier to get up and go with children and the gastroenterology practice, that going in the morning immediately after getting up with a fast is the way to do it. And then I don't eat before the race. Like I experimented with a lot of things over the years. I estimate I've ran more than 75 races now, and I've tried different things, but just not putting anything down there and going just with the UCAN and the water. I seem to do the best. I will say that most people tend to undereat. There's a lot of data that's saying that we need a good amount of calories. And so most people are probably underfueling, especially if they're new. They're scared. They don't know what to get. They haven't tried many things. And so I would encourage people to try to eat something. And if you get it wrong, you can change it the next time and keep going, because most people are having some issues with upset stomach and getting the nutrition that they want.
Yeah, I think I was close to a fasting runner. I would have maybe that much just black coffee. I would have a half of a piece of toast, plain, and then that much of a banana before a marathon. That was my thing, and it was perfect. And I never had knock on wood, any issues. But I had to have a little something, but I couldn't eat that. I couldn't eat that much. And when I was practicing, mostly I would run fasting.
I think that's very common practice for morning runners.
Yeah,
afternoon runners. Most people probably will eat breakfast or lunch, and then traditionally we know that almost all the stomach is emptied in 4 hours. A lot of stomach emptying in 2 hours. So most of the time it kind of goes back to when we were kids in the swimming pool. Take a break after lunch and then you can go swimming. It's the same thing. I think that because running is more violent in the jostling, we tend to need a longer fast to get more stomach emptying before we run.
So once we're running and we're done with the race, we also have to think about possible digestive issues, like if people are gorging, after you finish a marathon. I was never starving after finishing. What I always craved was like a Coke. It was the weirdest thing. I just wanted a Coke after I ran my marathons. But what should we do? Like, what do we do so we avoid, on the other side of not having any issues by eating too much too soon?
Sure. So you probably want to start eating something within a short time frame. And so we think about a couple things. One is the carbohydrate, because your glycogen stores are depleted. You don't have any sugar on board. And so getting some carbohydrate or sugar in is very good. And also you think about, you're going to have to repair all your muscles and the damage from the running or the endurance event. And so some sort of protein. A lot of people like chocolate milk. I like the chocolate milk. It goes down well after a run. And so usually if the post-race tent has that, then I go for the chocolate milk. Some of the large companies are making dairy-free protein drinks that have some sugar and protein as a recovery drink, and those do pretty well, I think, for people. You also see a lot of salty snacks. Many people don't always put salt or sodium in their mixture or whatever they're eating or drinking. But we know electrolytes is very important. It's not necessarily GI distress, but you will get distress if your sodium drops low because of too much water, not enough salt. And so I'd say most people are focusing on getting their fluids in, getting some salt, getting some protein, and getting some carbohydrate immediately within the first, say, like 30 to 120 minutes. And then as your temperature cools down, as your blood flow returns to your gut, you're probably going to have bowel movements. Many runners have loose or urgent bowel movement after the run, especially after some of the food and drink starts to go in. It has urgency coming out. And then later on, you probably want to go ahead and eat more. Having a plan. A lot of runners, they eat the snacks and then they're like, oh, I got to drive back or go to work tomorrow. And so they start driving, and then they get in a pinch or an insecure food situation where they're stopping at the one restaurant. I heard a story recently where the runner stopped at a restaurant and they ordered some shrimp appetizer, and then their computer system crashed and they couldn't sell any more food.
Oh no, that's awful.
So those stories are out there.
Yeah.
Where people have not had a plan. And yes, we live in a very rich food society here in America, and most people have good access, but having a plan, and many of us get hangry. We are very hungry and we start getting irritable. Your whole body hurts after the marathon, and you're just like, give me something to eat. And so, my wife usually has a bag of snacks ready to go because she knows the drill.
That's awesome. So I do want to touch on this one point. When should an athlete see a doctor or their healthcare provider? Like, when is it beyond just a running thing or an exercise thing, and it's something to be concerned about?
When symptoms don't go away quickly after exercise, when they persist, I think when they have signs like bleeding, anemia, weight loss, those can be more serious and maybe something beyond our topic today.
Right.
The symptoms that don't go away may be more of like an overall GI condition than just exercise induced. And so we know things like GERD, IBS, Crohn's disease, ulcerative colitis. Many of these things, they flare or they give people symptoms when they exercise. And so maybe getting under better control for those conditions would lead to a better exercising experience.
And also, I want to point out, we talked about this a lot with our dietitians, is of avoidant and restrictive eating. If we want to caution, and I'll let you speak because you're the doctor, but as a patient advocate, caution patients that if they find themselves afraid to eat certain foods or they're avoiding foods because they're worried about having an issue, is that a time to speak to a dietitian or a doctor, because that's going to deplete a lot of nutrients and it could have negative effects in the long term, especially doing those long endurance races or just any exercise.
Absolutely. So we do have, a small segment of elite athletics, especially elite distance running, really struggles with nutrition, eating disorders, body image concerns have been a thing in this field for a long time, men and women.
Oh, yeah.
Not just the very young, but more middle-aged as well. We probably all know a distance runner that's underweight or has problems with osteoporosis or other conditions. And so, yes, trying to eat. I think that's number one thing is eat. We talk a lot about what to eat, but that includes eat.
Yeah, and we have great resources on Gastro Girl and GI On Demand for very well-educated and experienced dietitians who can help in all areas of GI. And also a lot of the healthcare providers are well-versed in guiding patients to the right resources. So
yeah, absolutely. I think those of us that run and participate, we have a lot of anecdotal knowledge. There's some book knowledge. There's a lot of exercise physiology journals that talk about this, but most patients don't really want to hear about like flow dynamics of splenic circulation. They want practical tips. So I hope we've been able to give the audience some of those things today. I would say, in a big overview of this topic is GI distress is extremely common amongst runners and exercisers, and that you can do some simple things to help. Having a plan, coming up with dietary items that work for you, and knowing when to seek help, I think are the big takeaways from this topic.
Well, this has been really eye-opening, and I'm so grateful for your participation. I know you're a well-respected member of ACG's Patient Care Committee, and this is a special edition episode of the Gastro Girl podcast brought to you by the ACG Patient Care Committee. And I want to encourage our listeners, if you're watching this on YouTube, please feel free to comment in the comment section if you have questions, and maybe we'll have Dr. Triplett on again to answer some of the questions, since I love the fact that you walk the talk. You're a runner, a marathoner, and you understand firsthand about this topic. So that makes it even more powerful for our listeners. And don't forget to like, subscribe, and share this episode with your friends and family. And we really appreciate you coming on today, Dr. Triplett. Thank you so much.
Thank you for having me, Jackie.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.